this is one question I get asked all the time. How do we know if a behavior is rooted in trauma? And if it is or if it isn't, do we still kind of practice these trauma informed care techniques with them? The short answer is it really doesn't matter if you don't know if their behavior is rooted in trauma. If we go back to this and we look at the aggressiveness, the disruptive behaviors, the shutting down, the detachment, those sorts of things. You may or you may not know if it's rooted in trauma. Like if you're a mental health professional like myself, you may have time and have been able to, learn about their life history, and then you might know, or you might not. You might be in an educational setting and be a classroom teacher and not know. That's okay. It's still good to practice the trauma informed care principles and tips and practices that we're going to go through in this course with them without even necessarily assuming that they may have been through a trauma. I always like to tell myself when I'm meditating on that tree, when I'm thinking of a traumatic adaptation, when I'm thinking about not taking things personally from youth who have been highly impacted by trauma, I always say this might be a result of trauma, and that leaves space for it, but also doesn't overly assume, if that makes sense, which is a good